Hi there. My name is Lindsay Gallagher. I live in Phoenix, which is in Southern Oregon, a little dinky town about 10 miles away from the small hospital where I work. It's a community hospital as part of a larger nonprofit hospital group. I have been a registered nurse for about 5 years now, all of that as an ER nurse. And I also work on call part-time 72 hours a month as a SANE, which is a sexual assault nurse examiner. So I do some forensic nursing and evidence collection and fact finding for victims of sexual assault. So I do both of those things. And then as well, I started doing some clinic precepting with a nursing student in the ER over the last 8 weeks. So I'm pretty busy. I also just took a job as a cath lab nurse. So I'm going to be switching from ER, which I've done for 5 years, over to cath lab. So I have a whole new skill set to learn and a huge challenge ahead of me, but it's very exciting. So how I see myself developing as a leader, that is kind of in flux right now because I feel like in my job as an ER nurse, having 5 years, I feel fairly comfortable in the role and, have done some leadership activities in that. I'm currently the direct care staff representative on the hospital staffing committee. So once a month, I meet with the hospital staffing committee, which includes the director of nursing, managers from all departments, and then one direct care nurse from each department as well. So our hospital is sadly non-union, so that is one area where I'm able to sort of provide some advocacy for my fellow nurses and some leadership in regards to safe staffing and appropriate staffing. And that's something that I try to bring my professional organization in with as well. So ENA has pretty clear guidelines about nurse to patient ratios as far as safety and advocacy goes. So that's something that I try to bring in. I'd say that's an area of leadership that has developed for me over the last year. I don't know what track that's going to take now that I'm starting a new job in basically a very different field. So obviously still nursing, but very different, and I have a lot to learn. So I'm probably going to be transitioning more into that sort of following role as I learn. And then of course, I have things to contribute as well through my experience as a bedside RN for 5 years in the ER. So yeah, glad to be in this class and very excited to be almost done with this BSN. Thank you.